but if you are that high achiever, just study hepatitis. What they usually ask in hepatitis is hepatitis A, B, C, especially the route, how people get that hepatitis. So A, B, C. So A is usually fecal oral. That means what they eat, what they put inside their mouth. So fecal oral. So it can be like a contaminated food or water. Okay. It's always acute. It's never chronic. So the person will recover. Okay. It's not it's not it's no there's no long term liver damage. Remember, it's just what they eat. Fecal oral. Very high yield in the exam. That is A. Then B is as a result of sexual contact. Okay. It can be spread by sexual contact. So most of the time in the exam, what they ask you in this topic is how is A, B, or C, any of these things spread. So if it is A is fecal oral, and it's usually acute and not chronic. Is what somebody ate. Then the next one is the B. B. B is usually, some people remember, mother to child. So it can be through blood, sexual contact, blood, IV drug user, IV drug user. Okay, so it's usually important. B, know the mode of transmission for B. Then we have C. C is also by blood exposure, especially IV drug user, IV IV drug user. Okay, IV drug user. That is usually the major thing for C. IV drug user, blood transfusion. Okay. Then we have another one that is D. So the D one is usually, it requires hepatitis B to replicate. So it occurs in people that have hepatitis B. So that is one thing about D. So D is usually, yes, people that have the B. It requires the B to replicate. But for the purpose of the exam, you need to know how A, B, C is transmitted. Okay. Then we have the E. E is usually also fecal oral, but is dangerous in pregnancy and is always dangerous for immunocompromised. But for the purpose of the exam, A, B, C is the one you always need to know how it's transmitted. Okay, A, B, C. Then there is another big thing in the exam, and we call it hepatitis serology. So let me see if I should bring this here. So this is a sample of what they can give you in the exam. And when they give it to you in the exam, it's either they give you A or B or C or D, and they ask you question. So they put it like this HBsAg negative, anti-age, so something like that. They put it for you in the exam, and they ask you to interpret it. And like I said, these are the questions you don't have to waste too much time to answer, because it's either you know it or you don't know it. That is one thing. Those are questions. The questions that either you know it, you don't know it, for something and flag it and move on to at least to get the ones that you don't know than wasting your time. Remember, every question is 1 minute. So in that hepatitis serology, so those are the words you must know. Okay, IgE, IgE. So I'm just trying to interpret this table for us here. So the first words that you must know, because that is how to help you to explain this serology. IgE. So IgE, it indicates past infection or immunity. It means that the body has antibody and there is no active infection. So there is no active infection. So some people use the word G as in gone, gone. That is why I have it here. IG gone, IG gone. So whenever you see IG gone, it shows that there is no virus or infection at the moment. It may be that the person was infected in the past, or they have immunity, or it means that they have antibody. But just know IG means IG gone. IG gone means there is no active infection. IG gone. There is no active infection. Then there is another one that is IgM. IgM. What is happening in IgM? Some people remember IgM as M as in minute. IgM, they remember it as in minute, which is IgM. So minute means positive. It indicates that the patient is contagious. The patient have a, so it's opposite of Ig gone. So IgM is patient have acute or recent infection, no immunity yet, patient is contagious. So that means the person is showing the symptoms at that time. Okay, Ig. So somebody that have hepatitis and they are showing the symptoms at that time, that is IgM. Remember M as moment. Okay, is having. Then there is another hepatitis B maker. We call it hepatitis B surface antigen. Hepatitis B surface antigen, and that is what you will always see in this question. This is hepatitis B surface antigen, HBsAg, and you're asking yourself, what is that? That is HB is hepatitis, S is surface, Ag is antigen. So anytime you see, because we are medical people, we need to call it, that is the abbreviation, hepatitis B surface antigen. Okay, it's a screening test for hepatitis B. So if it is positive, if this hepatitis B surface antigen is positive, the virus is present and the patient is infectious. Okay, so it shows the same thing. So it's showing the same thing as IgM. So it shows once it is positive, it shows that the patient is what? The virus is in present and the patient is infectious. Then after that, we have another one, which is hepatitis C. So we call this one anti-hepatitis C virus. These are the makers. I know, like I said, this is not something you need to take your time, because if you don't know it, you know it. You don't know it. If this anti HC, if it is positive, okay, if it is positive, so that means you have to order HCV RNA and PC. So you have to order the you have to order those RNA and PCR if it's positive. So always remember anti, which is the antibodies. When you hear anti HC, anti HC is antibodies. to hepatitis C virus. I'm not wasting my time, but it's something like I said, if you don't know it, you don't know it. So because all this abbreviation is so confusing, but that is the full meaning. Anti means antibodies to hepatitis C virus. Okay, so it's dictated, it dictates antibodies your immune system makes after exposure to hepatitis C. So when somebody is exposed to hepatitis C, like we said, what are the sources? If somebody is exposed through um, drug IV drug use, okay, the person may have that antibody, antibody. So that is anti C. Okay, so if that antibody is present, they are going to do RNA test or PCR test because it helps to show if there is a current infection, or if it shows if it is a current infection or past infection or false reading. But just remember, anytime somebody have the antibody present, they can go further to test the person. So all this word, remember the anti-HBc, which is what we just said now, anti the anti-HBc hepatitis antibodies, hepatitis B core. Then when they bring out all these things that we are saying here, okay, then they will ask you a question. For example, the first one, HBs, which is hepatitis B surface antigen. If you remember what I said, that hepatitis B surface antigen is what shows that somebody is actively infected. Okay, that is what shows somebody is actively infected. So if that is negative, so that means that person is not infected. If the antibody too, if the antibody too, as we know, if the antibody to anti-HBc is negative, that shows, and the antibody HBs, all of them are all negative, it shows that the person is susceptible. So the same thing, all the thing we are saying, but all you need to pay attention to be able to answer it in the exam is look at this HBsAg, this one here. If it is negative, just know that the person is not showing symptom or they don't have it. Then you also look at IgM. Remember this IgM minute. If this minute is negative, it shows that patient is not showing any symptom at that moment. Okay? But the HBs, which is the antigen, remember antigen, anytime antigen is present, it shows that that person has some kind of hepatitis infection in their body. So they may be exposed. So that one is chronically infected. So if everything is all positive except the antibody against the hepatitis B surface is negative, then the person is acutely infected. So like I said, this is not something you will spend your time memorizing. It's just question in the exam. If you know it, you know it. If you don't know it, you know it. So if you don't know it, just choose what you think might be answer and move on, and spend your time to answer other questions, because there's no other way that you can be able to. It's just a yes or no. If you know it, you can pick the right answer. If you don't know it, you cannot be able to pick the right answer. But other than that, continue to look at it again and again. If you really want to be a high achiever and to get it in the test, continue to look at it. If everything, if the Hepatitis B surface antigen is negative. The antibody to the hepatitis B is core is negative. Then the antibody against hepatitis B surface is positive. Then it is immune system. The immune they have immunity, or they have a natural infection. So I know it's confusing, but just look at it again and again, and you can master it.